There's a 16-year-old, she's a transgender, she's also injecting drugs, and she's also in sex work.
Yankee affected populations are young people who are living with HIV, young people who are MSM, young people who are transgenders, young people who use drugs, and young people who do commercial sex works.
The dynamics of the Yankee affected population is very unique and very different to the general youth population. They are engaged in behaviors that they adapt or they are forced to adapt, which increases the risk of being infected with HIV. And right now we all see and we can all observe that the HIV infection is getting younger and younger.
AIDS Commission in Asia reported 40% of new HIV infections in this region are among young people, and from that 40%, 95% of them are Yankee affected people.
We are the person which are more vulnerable to STIs and to HIV and AIDS, and we are the biggest sources from where people can stop HIV and AIDS, but people don't give attention to us.
They are the most vulnerable for HIV in terms of few reasons, like access to information, access to services, access to a proper health care services, and also the stigma and discrimination they face from this system. So that is why they are unique in HIV response. There are so many barriers when you access to information and services, because many service delivery centers ask your age. Many service delivery centers want to know whether you are married or not, or what is your sexual history when you access services related to sexual and reproductive health.
They have to provide services to youth which protect youths, and there are not so much fund. There are limited programs which is helping youth.
Really difficult to reach Yankee affected people. So maybe that is one reason, maybe that is the reason to not available information and data about Yankee affected people. But same time, generally HIV/AIDS response in national level has completely avoiding collecting data on young people.
The best way for a government to address issues that is faced by the Yankee affected population is to consult them. They should realize that the greater and meaningful involvement of this sector of the young community will help leverage existing strategies, or even when they plan strategies, it will really help them because they are the ones who plays around with the epidemic.
So UN agencies and other civil organizations and also government should prioritize Yankee affected people when they make policies, programs, and especially when they allocate funding.
Youth lead is very important because each of one of us represents the key affected population, and it is a great venue for all of us to deliver our voices as one.
We want to be united. We're working at the country level, but we don't know what our neighbors are suffering from. If we can unite, we can do much more things and know what other people are using techniques. So it's very helpful. So but I think it's the best idea to to get our regional level unity.
We are there at the whole situation of HIV and AIDS, so key affected population should be included, and Youth Lead is one of the good example of it. Really,
it's a network of Yankee affected people from all the countries in Asia and the Pacific. So we have country level representatives, so they all made the Youth Lead regional network for Yankee affected people. have focus this year is capacity building of young key affected people in country level. We are involving with other regional and national level work, especially advocacy work, so we feed real national level issues young key affected people face to regional level.
Youngsters don't want to go to those clinics or even to the doctors.
Yeah.
So regardless it's being cheap and it's accessible in their village, but if the attitude of the service providers are still negative.
What was that?
I mean, it's acceptance. This is the word. The acceptance, because it might be accessible, it might be affordable, it might be available. So then again, if they don't want to be, accepting us as we are, so I would regard it as useless.